Hi, let's talk about obesity in children. So, what is obesity? Obesity is defined as an increased fat mass in the body which is relative to the child's weight, height, or the gender. So, in technical terms, we describe or define obesity with the help of a tool called body mass index. So, a body mass index which is more than 85% for the child's age and gender is considered as overweight, and a BMI or body mass index more than 95% of age is considered as obese. So, what is wrong with being obese? Young children who are overweight or obese, they grow on to become obese adolescents as well as adults. So, obesity has a lot of short-term as well as long-term complications. Obesity, which persists into adulthood, is the major cause for a lot of lifestyle diseases such as type 2 diabetes, abnormal lipid profiles, hypertension, and abnormal or adverse cardiovascular health. So, what are some of the short-term and long-term complications that can occur because of obesity? So, let's begin. The most important thing is an increased risk to develop diabetes or high blood sugars. We have seen increased numbers of children developing type 2 diabetes at a much younger age. Apart from that, this diabetes which occurs is going to persist lifelong, and children are going to end up with complications of the same much earlier in life. The other comorbidities include prehypertension and hypertension, that is high blood pressure, abnormal lipid profile, so the child will develop abnormal proportions of unhealthy cholesterol and triglycerides and other fats, which over a period of time can lead to adverse cardiovascular health, increasing the risk for heart disease in young adults as well as the child grows older. This can lead to something called non-alcoholic fatty liver disease because of increased deposition of fat in the liver. Children can also develop other comorbidities. Because of the body mass, they may not be able to be physically active. They may become tired easily, and the work of breathing may be increased. Children with severe obesity can develop something called sleep disordered breathing or obstructive sleep apnea, and this can lead to disturbed sleep at night and increased daytime sleepiness, and it can also affect the behavior and concentration and academic performance of children. And in the long term, this can also lead to adverse effects on the child's heart. So apart from these, what other complications can we expect? Due to the increase in the body mass, there is increased weight bearing, increased load on the muscles, especially the knees and the hip joints, which can lead to something called slipped capital femoral epiphysis and also knee pains and knee joints in the children, which may further limit their capability for physical activity. Apart from these, there are few more complications that can be seen. Girls especially can be at increased risk to develop something called polycystic ovarian syndrome or PCOS, which can lead to menstrual abnormalities and also future problems with fertility and things like that. So the most important thing which may be overlooked is the psychological impact of being overweight or obese. So these children many often can be the subject of bullying, teasing, and these children may be depressed. They may not be able to communicate their feelings with anybody. They may be body shamed. People may use names and make fun of these children, which can affect their psychological well-being, and it can also affect their academic performance. So this is why obesity can lead to so many complications in the short and long term, and it's important to address it right from the beginning. So what are the causes of obesity? So the most common cause of obesity is what we call exogenous, which is because of our lifestyle. Rarely there could be some genetic conditions, or there could be some hormonal problems, or some abnormality in the nervous system which can also give rise to obesity. So what are some of the risk factors that can lead to obesity? Few things to remember are children who are born low birth weight or those who are born large for gestational age, what we call as macrosomic or large birth weight babies, those who have a family history of obesity, having one or both parents who are obese increases the likelihood of the child also becoming obese. And in certain situations, the children may be on some medications such as anticonvulsants or antidepressants and things like that, and this can also increase the risk of the child becoming obese. So coming to the management of obesity, obesity by far is a treatable condition. So how do we treat this? As we all know, each child with obesity is different. So there is no one size fits all. It is best to consult a specialist who can guide you about the right test to be done, the right assessment, and give you the right advice. At Aster RV Hospital, we are starting Fit Kids and Teens Comprehensive Healthy Weight Clinic, which is a new initiative. The clinic is going to be launched on the 18th of August, and we are going to run the clinic on the first and third Fridays of every month between 3 p.m. to 6 p.m. So in this clinic, you will get to meet all the experts, including a pediatric endocrinologist, a pediatrician, and a pediatric nutritionist, all under one roof. Here, the child will be assessed comprehensively and a customized plan will be provided based on the assessment made. At the Healthy Weight Clinic, we are not only going to be managing kids who come with obesity, but we will also be addressing concerns of children who are underweight, who are born small or low birth weight and premature and who are having difficulty in catching up growth, children who are picky eaters, children in whom the parents are out of ideas to feed them with healthy meals. So here we will be providing growth assessment, dietary assessment, as well as a customized meal and physical activity plan.